back. How are you feeling today? That's good to hear. So we're here for your annual physical exam today, and Nurse Henry took your medical history and said you did have a couple of concerns. So she said that one thing is your hearing sounds a bit muffled. Okay. Is that in both ears? Yeah. How long has that been going on? Just the last month. Okay. So we'll go ahead and take a look at your ears definitely and see if we can see what's causing that. How bad is the muffling? Do you often have trouble hearing? Do you have to turn up the TV really high or anything? Okay, so not too bad, but it's noticeable. Any pain? No? Okay. Alright, and she said that you're having the same sleep issue you discussed with me last time you were here. Yeah, how much sleep do you get a night? 10 to 12 hours, and you still feel tired and sleepy during the day. That's definitely not the norm, so we want to go ahead and take a look at everything and see if we can pinpoint a cause. Your blood work from last week came back and looks really good, so we might actually have to refer you to a specialist, see if they can do a sleep study. Okay, but for now, I'm just going to go ahead, go through your physical, see if anything is wrong. You look very healthy, so we'll just make sure that's the case. And I'm going to go ahead and start by taking your blood pressure, okay? Alright, just get my stethoscope on. I'm going to go ahead. If you could just uncross your legs for me, please. Okay, thank you. Just put this around your arm. Alright, and I have 120/80, which is a very healthy blood pressure. 120/80. Excellent. Okay, now I'm going to go ahead and put on my gloves and we will take your temperature next. So that sleepiness issue you've been having, how long has that been going on? Years. Okay. Yeah, we definitely want to get that checked out because I don't want you going through life tired all the time. There we go. Okay. Now, thermometer and a cover. Just make sure that your temperature is full. There. Alright, if you could just go ahead and open your mouth. I'm going to put this under your tongue, okay? Alright. Under your tongue. Okay. 98.6, perfectly healthy. That. Okay. Now I'm going to go ahead and get your heart rate. I'll do that by feeling your pulse in your wrist, okay? I have your wrist, please. Thank you. Perfect. Very healthy resting heart rate of 62 beats per minute. Nothing to be worried about there. Now I'm just going to do a visual examination of your skin. Just making sure that the tone is correct. We're looking for any lesions or bumps. Okay, arms, legs. If you could just please hold out your hands for me, I'm going to take a look at your nails, okay? Yeah. Tone looks good. Healthy nail beds. Okay. Excellent. Now, I do see that you have a mole on your neck that I noted from last time. Last time we measured it, so I'm just going to go ahead and get a measurement to make sure it hasn't grown at all, okay? Alright. In here. Neck. Okay, I have 0.35 centimeters. So last year I measured that at 0.25 centimeters. It has grown a bit to 0.35 centimeters. Visually, it looks healthy. It doesn't look like it will be a problem, but I think it would benefit you to see a dermatologist just in case. So we'll have a dermatologist take a look at that for you. Again, I don't expect it to be an issue, so nothing to worry about, but we just want to be extra safe with any skin growths, okay? Right. Now I'm going to go ahead and take a look at your scalp and your hair. We're going to be looking for any signs of alopecia or any scalp issues such as redness, dryness, flakiness, okay? Come in here. Alright, just looking at the scalp. Hair looks good. I'm not seeing any signs of hair loss. Scalp looks good. Just a little bit of dryness, but overall very normal. No discoloration on the scalp. Do you ever have an itchy scalp? Do you find that it bothers you at all, that dryness? No? Okay, that's good. Now, if you do find that you're having any issues with itching or the dryness escalates, you could try something like Head and Shoulders, see if we can take care of that. But overall, looks really good. If you're not having problems, I don't see anything that we should worry about. All right. Now we're going to go ahead and start looking at your eyes. I'm going to start by putting my hands behind your head and bringing them forward. Let me know when you can see them in your peripheral vision, okay? So go ahead and stare straight at me, and we're going to be seeing when those hands come into view. Get behind your ear, come forward. Okay, good. And which one was moving? Left hand. Very good. One more time. Okay. Bring them forward. Which hand moved? Right. Okay. Excellent. Now I'm going to go ahead and take a closer look in your eyes. I'm going to pull your eyelids up and down. Nothing extreme. It will not be painful. I'm just looking at the color of your iris and your pupil. Okay? Go in there. Look at that eye. Okay. Left eye looks very good. Whites are white. Parts that's supposed to be pink are pink. Pupil looks healthy. And other side. In there, looking at that right eye. Same there. Eyes look nice and healthy. And now, go ahead and get out my little light here. And we're going to be looking in your eyes with this light. Now, if you could just, again, look straight at me. Do not follow the light. Straight at me. Down and back up. Good. Pupil dilation and constriction is normal. Other side. Down and back up. Very good. Pupil dilation, constriction, normal in both eyes. Pupils look good. Again, keep looking straight at me. I'm just going to go back and forth between your two eyes. Okay. Excellent. That looks very good. Now, if you could just follow my pen as I pull it in and out. And in. And out. And in. And out. Excellent. We're just making sure those pupils converge in the center. You go cross-eyed, so that is excellent. Now I'm going to be moving the light around. I'm going to have you follow it with your eyes. Face forward, please. Only move your eyes. Up, and down, and across, and up, and down, and across, up, down, and across, center, up, and down. All right. Eyes look excellent. I'm going to move on to your ears. So I'm going to actually be whispering into each ear. Tell me what you hear, okay? So we'll start with your right ear. E36. E36. Other ear. F52. F52. Very good. And I'm going to come around behind you and do the same thing. You're going to tell me what ear you hear it in and what I've said, okay? G14. Left ear, G14. Very good. M19. Right ear, M19. Excellent. Okay, come back around. Okay, it seems like your hearing is pretty good, although you've said it sounds muffled to you, so it could be relative. We definitely want to check out the inside of your ears to look at that. I'm going to go ahead and come a little bit closer. I'm going to be looking at the outside of your ears for any signs of masses or lesions, discoloration. I'm going to be touching them as well to feel for any abnormalities, okay? Alright, let me know if anything feels painful or tender. It shouldn't. Just get in here. Okay. Left ear looks good. No discoloration, no masses, lesions. Feels good to the touch. Okay. And nothing painful there. Okay. And right ear. Okay. No discoloration, no masses or lesions. Touch feels good. Okay. So ears look good on the outside. Let me go ahead and look at the inside. So I have my otoscope here. And we're just going to be using this to look inside those lovely ears, okay? I'm going to start with the left side. Again, I'm looking for any discoloration, wax buildup, damage to the eardrum or ear canal, okay? Alright, yeah, there is some wax buildup, so that could explain the issue that you're having with your hearing. Ear canal looks good, no redness, no damage. Okay, lovely. Alright, right here. Okay. Yeah, same thing, some wax buildup. So that definitely was something we want to take care of for you. I do see a little bit of redness in here, but no injuries to the ear canal or to the eardrum. So the right ear, have you been getting in there at all with a Q-tip? Yeah, okay. Yeah, that could be causing that redness. I'd like you to try to avoid doing that. I know that it can be a little bit uncomfortable if you feel like you have wax stuck in there, but you can actually do a lot of harm by putting anything into your ears. You could cause damage or even a rupture to your eardrum, okay? So I'm going to go ahead and get you a referral to an ear, nose, and throat specialist who will be able to do a thorough cleaning on that ear and make sure that there aren't any other deeper issues with the hearing, okay? Alright. Now I'm going to be looking at your nose. First, we're just going to do a visual inspection, looking for any masses or lesions, just like before. Seems straight and symmetrical. And then I have my otoscope again. I'm going to go ahead and pull up on your nose and look in there. Okay, start with your right nostril. Okay, right nostril looks good. Excellent, no masses in there. Looks good color-wise. Right nostril. Same thing, no masses and looks very good color-wise. So nose looks good, septum is not deviated. No issues. Have you had any issues with snoring or trouble breathing through your nose at all? No. Okay. Excellent. So that's something that they will ask you to if you end up going to a sleep doctor, because one of the first things they try to rule out is sleep apnea or any breathing issues that could be causing your trouble sleeping. So it doesn't seem like that is the case, but we have to check. Now I'm going to go ahead and I'm going to be touching your face. I'm going to be palpating around looking for any masses, and we're also going to be checking muscle tone, okay? Start with the forehead, temples, cheeks, and jaw. Okay. Everything looks good there. I do not feel any issues. Muscle tone seems good. Alright. Now we're going to get in your mouth a little bit. I'm going to have you show me your teeth and gums. Good. I'm going to pull down on your bottom lip. Just looking at your gums for any discoloration, lesions, or masses. Oh, good. Top lip. Same there. Nice and pink. No redness, lesions, or masses. Now we're going to do a more thorough inspection inside the mouth, looking at the back of the throat as well, the tonsils, uvula, and throat muscles, okay? Looks good in there. Coloration is good. Muscles look good in the back of the throat. Uvula is good. No problems there. Now I'm going to have you go ahead and stick out your tongue for me and move it side to side. Okay, and to the left. To the right. Okay, tongue looks good. Muscle tone of the tongue is perfect. Now I'm going to be palpating the lymph nodes in your neck, just making sure I don't feel any swelling, okay? Get in here in the neck. Looking for any swelling of the lymph nodes. That looks good though. No issues. Okay, so neck feels good, no swelling of the lymph nodes. Now I'm going to go ahead and feel your trachea. And swallow for me. So trachea feels good, muscle tone in there feels good. I'm going to come around back and feel your muscles. Okay, so I'm just going to be going ahead and feeling the muscles of your back. And making sure everything in the muscle tone feels good. Excellent. Now I'm going to be tapping on your back. We call this percussing, and what I'm doing is feeling for organs, placement, and any obstructions. So everything back there looks just fine. Next, I'm going to be listening to your lungs with my stethoscope. Get this on here. So I'm going to reach around behind you, and I'm just going to have you take a deep breath in and out, and in and out. Okay, the other side, and in and out, and in and out. Now from the front, I'm going to do the same thing. In and out, and in and out, in and out, and in and out. Okay, lovely. Now I'm just going to listen to your heart while I'm here. Listening to your heart for any arrhythmia or unusual heartbeat, any murmur. Sounds good. Now I'm going to listen to your arteries in your neck. Okay, another side. Alright. Excellent. So lungs sound perfectly clear. No crackles or anything that I can hear in the lungs. Your heart sounds great. I do not hear any arrhythmia or murmur. And arteries sound good. Now I'm going to do the same thing where I tap on the front, looking for organs. Okay. Excellent. All right. Perfect. Now we're going to be just going through a few motions to test your muscles. I'm going to go ahead and have you turn your head to the left for me. And to the right. Very good. And touch your ear to your shoulder if you can. Good. And other way. Very good. Did you feel any soreness or stiffness when you did that? No. Okay, good. Now if I could have you just shrug up for me. Good. Now I'm going to put my hands on your shoulders. I want you to shrug against resistance. So I'm going to try to hold your shoulders down. Shrug. Very good. Same thing except in reverse. I'll have you shrug and hold it. Hold and hold and hold. Okay, perfect. Ability to shrug and hold against resistance. Lovely. Now we're going to do a couple cranial nerve exams just to make sure all of your cranial nerves are functioning as usual. Grab a Q-tip here. This is soaked in a solution that has a scent. So I'm going to come in. I would like you to plug your left nostril. I'm going to start with your right nostril. Inhale. And what do you smell? Mint. Correct. Okay. Great. Other one. Okay, same thing, but in reverse. Go ahead and plug your right nostril for me. Okay. And smell. What did you smell? Cinnamon. ahead and feel your temples and jaw while you clench. So I'm going to touch your temples. Go ahead and clench your jaw. Good. Go ahead and clench. Very good. Okay. Muscle tone is good there. I have another instrument here that is sharp on one end, dull on the other. I'm going to be touching you gently in different areas. Tell me whether you feel sharp or dull, okay? It doesn't hurt at all. I'm going to touch you very gently. Okay. Sharp, dull, sharp, dull, dull, sharp, sharp. Very good. Alright, so sensation there looked good. Same test, except this time I'm just using a cotton swab, so I'm going to touch you very gently. Let me know when you feel the touch, okay? Good. 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 All right. Excellent. All right, now I'm just going to have you make a few faces for me. Big smile with teeth. And frown. Good. Puff out your cheeks. Excellent. Now go ahead and puff out your cheeks. I'm going to press on your cheeks. Don't let any hair out. Puff. Excellent. Okay, so that concludes your annual exam. Just go ahead and we'll go over some of the results for you. Everything looked really good. The only issues that I'm seeing, just want to get you into a dermatologist for that mole on your neck. It doesn't look like it's an issue, like I said, but we want to make sure. So we'll get you a referral to a dermatologist. And then also the ears, we want to make sure those get cleared out for you so you can hear better and you're more comfortable. So I'll get you to a specialist, an ear, nose, and throat doctor who'll be able to do that. And then for your sleep, I don't want you to have to go through life tired. So actually the ENT that I'm sending you to also specializes in sleep because they do sleep apnea, but they can also schedule a regular sleep study for you that would look for all manner of sleep disorders. So we will get you to that ENT for the sleep as well. So that is 2 referrals for 3 things. I'm going to write those up for you. Do you have any other concerns or any questions for me? No? Okay. Well, I'm glad to see that you're overall in very good health. I don't see anything that is a real concern. I'm going to go ahead and get those referrals written up for you. I'll put them up at the front desk for you on your way out. And for now, I don't need to see you back until next year unless anything comes up, okay? All right. So I'll go do those referrals. Nurse Helen will be in to walk you out. Have a great day, okay?